Hi guys, we're going to be doing a reaction to Botox and fillers. How Young is Too Young by Watella Center for Plastic Surgery. Let's do it.
When is too young too young? And we have patients coming in for fillers in their face, their lips, who are in their late teens. More and more 20-somethings are coming in to have Botox and fillers.
So why would someone in their 20s or even in their early teens come for Botox? The obvious reason when we think about Botox are our wrinkles. Genetics play a huge role, sun damage, people who are very expressive or have strong musculature, so they want to tone those things down. So the answers vary. But the other thing I want to point out are there non-cosmetic reasons to get Botox. I have two patients, 17 years old, with parental consent. They come in. One I treat for hyperhidrosis, so that's excessive sweating under the arms, and the other I treat for TMJ, and she was actually referred by her ENT. So it's important to point out that there are other reasons to get Botox as well.
And I think that my own personal philosophy on this has changed a little bit. I think some of the requests are inappropriate. I think when a 21-year-old comes in and wants her folds completely filled in, and they don't even extend to the corner of the mouth, she's reverting back to when she was a baby, not when she was a teenager. And I think that that's inappropriate.
People come in all different ages, and it's our job as a provider to sit with them and listen to their concerns. I think as a provider, we can only guide you and educate you to make the best decision for yourself. I always go slow and steady with my patients. For something that he's talking about with the nasolabial folds, I have young women come in, and I always educate them that even though their folds aren't that deep yet, or if they don't extend to the corner of their mouth, there's always a little something that we can improve on, even for preventative care. I do have people coming in and I'll put maybe 0.2 to 0.4 in each side of the piriform fossa, and that will give you much structural support later in life to do these procedures.
I think that you always have to remember what you're trying to do and create naturalness. When a 22-year-old or 25-year-old comes in and they've been frowning since they were 10 and they start to have a frown line and it's deep, they may not only need Botox, but they may need fillers at that age. And so that's totally appropriate. I get a lot of 20-somethings who come in and are doing some maintenance Botox because early in their family history, they get very deep lines between the brows.
Family history plays a huge part of it, and that's why people ask, how soon is too soon to treat them? And I think that that's a question you can only answer for yourself. It's very personal. It's a subjective answer. I feel like if you're comfortable in your skin or you're aging gracefully, keep it that way. But if there's something you want to rejuvenate or work on, my chair is a no judgment zone, and I'm happy to help within reason, of course. So let's say you have a family history and you have deep lines already at a young age and you're ready for Botox and wondering about the wrinkles. We always say to start with topical first. There are so many different factors that play a role why we have wrinkles. So in your 20s, you can start a nice skincare process. You can use sunscreen, retinol, vitamin C. But as you get to your late 20s and early 30s, your dynamic wrinkles are the ones that you make when you're making expressions, and they're there. They become static wrinkles, and static wrinkles are there even after you're not making the expressions. So you start to form those deeper wrinkles just because of that constant facial movement. So I like to think of Botox kind of like a sunscreen. Will sunscreen work after sun damage? Of course it will, but would it have worked so much better if we started it early on? For sure. So people tend to view Botox as something different because it's a medical procedure, it's a medication placed under the skin, but I really have to say it works for preventative purposes. So it really makes a lot of sense to use it like your topical. And I say that because all the other treatments that we have for wrinkles, they can actually be more expensive and more invasive later on. We have things like filler, like Dr. Vito's pointing out. We have things like microneedling, lasers, threads, and even facelifts. So it's something to think about. Using Botox early on can prevent you from needing those services later.
I think that's appropriate. So I think that, whereas I probably had a philosophy 20 years ago of not treating anybody under 30 with Botox and fillers, I think now you really have to take it on an individual basis, and some of it's very, very appropriate. So I think it's important to be honest with the patient. I think you really have to evaluate their age and what they're asking for, Is it appropriate for a 15-year-old to want lip enhancement? These are some of the ethical questions you have to ask yourself. But I think 20-somethings are now more and more asking for Botox and fillers, and in many of the cases, it is an appropriate treatment.
I think it's also important to mention that for those younger patients that are wanting things like lip filler because of everything out there on the internet nowadays, I have them come in quite a bit and I do still listen to them. Sometimes they come with their parents, and like I said, it's a no judgment zone. I do take the time to listen to their concerns, understand them, and respectfully decline the procedure, but it's my job to have an opportunity to educate those people because they may be coming in and not know that their daughter is too young for a procedure. So it's really important that I take the time to educate them and tell them why it's best to wait. So for providers, if you have a younger patient coming in, I think it's really good for you to sit and educate the patient as to why it's best to wait. And then maybe you'll see them again in the future and you can build that bond and trust together. I hope you guys enjoyed this video. I will see you next time. Don't forget to like, comment, and subscribe. Bye.